Hi everybody, this is Scott Kotlitz. I'm the president and owner of Acros Medical Technologies in Germany. We do manufacture all of our products in Germany. Now I certainly do appreciate your time and having a closer look at one of our superior products, that being the SC500 surgical chair. That chair is being used for ophthalmology, ENT surgery, maxillofacial surgery and implantology, for plastic, reconstructive and aesthetic surgery, and also for skull-based and neurosurgery. Another interesting feature is our vertical footrest. With all other products, your footrest would stick out at an angle anywhere between 30 to 40 degrees, which makes it very difficult for elderly or handicapped people to get into the chair. They would have to climb in from the side and then swing their legs over, which to elderly or handicapped people is very cumbersome. Not so with us. Our footrest folds back beyond vertical, so your elderly or handicapped people could easily back up in the chair and just sit down like on a comfortable stool. Have a closer look at our unique headrest. For one thing, it's electrically height adjustable, but it does offer a number of additional features. We have taken a different approach in supporting your patient's head. Unlike a head bowl where you would need gel cushions, towel or tissue to stabilize your patient's head and keep it from wobbling, you don't need that with our two soft cushioned bars. The bars do vary in distance, so you are in a position to accommodate any head size, be that very small heads or very large heads. Also, those two soft cushioned bars effectively prevent any pressure points as they follow the contour of the impacting body. As it comes to head positioning, those two soft cushioned bars and the multi-articulated mechanism of our headrest opens an unlimited number of positioning possibilities. In order to level your patient's head to a comfortable level, all you would have to do is, as you recline your patient to a horizontal position, just open this one lock, and the weight of patient's head will push those two soft cushioned bars into an ideal horizontal position, as the pivoting point is right underneath the center of gravity of your patient's head. From here on, your patient is firmly supported. The head will not wobble at any point of your surgical procedure, and your patient feels comfortably positioned on the soft cushioned bars. In order to comfortably accommodate your patient's head, just vary the distance between those two soft cushioned bars. As I mentioned earlier, you can go very narrow to accommodate very small heads, or widen the distance between those two bars and accommodate very large heads. Each head is being accommodated individually, thus supporting it very comfortably. In many cases, doctors go to great length to twist their body around patient's head in order to get to some far remote surgical areas. Now, in doing so, they put a lot of strain on their spine, which will result in pain and aches during an extended surgical day or an extended surgical life. In fact, what they should be doing is position their patient's head so they could always maintain an upright posture and take all the strain off their spine. Now, with our unique multi-articulated headrest, any doctor would be in a position during the procedure under sterile conditions to go from a vertical to a sideways orientation, to a head-low sideways orientation, or whichever position your surgical procedure would require. Well, let me show you some examples here. All you would have to do is, through the sterile fabric, open this lock And now you will notice those two bars, they do pivot a little. Now all you would have to do is grab your patient's head and position your patient's head sideways, push those bars a little, grab through the sterile fabric, and lock it. Now you would have a straight axis from the side. You could always repeat that maneuver at any time during your procedure. Go back vertical, go on over to the other side, and get access from the other side. Now this will allow you to maintain that vertical upright posture that takes all the strain off your back and releases all the pain. When it comes to accessibility to your patient's head, there's no question that the SC500 will leave unanswered. No matter if you would be going in from like 12 o'clock, 3 o'clock, or 9 o'clock, there's always ample of leg space underneath the backrest. You can easily access the optional foot controls or other foot controls that you may have on the floor for like microscope, high frequency equipment, vacuum machines, or other. As you change from a 12 o'clock to a 3 or 9 o'clock approach, same conditions do apply. The very narrow headrest allows you to get very close to your patient's head, but still you do have ample of leg space underneath your backrest. To further enhance your surgical workplace, Acros offers a number of convenient accessories and options. For example, standard armrests, which will tip onto the side and prevent your patient's arm from sliding off to the side. Or multi-articulated armrests, which of course are height adjustable, and they are sitting on a ball, so you could position those armrests into any position you so choose. In addition, we offer foot controls for height and backrest, which are also removable from that tray, so you could put them on the floor to a convenient position that would allow you to access those controls from a 9 o'clock or 3 o'clock position. In addition to this, we do offer either stainless steel drape supports or a flexible gooseneck which features a little oxygen tube, so you could vent some fresh air to your patient's face. Safety ratings for the side and a swiveling instrument trays are also available options.